All right, welcome. Today, we're diving into something that's basically a flight plan for one of the most incredible journeys anyone can take, pregnancy. It's called antenatal care, and it's all about making sure that trip is as smooth and safe as it can possibly be. Now, really think about it for a second. What if you had this super detailed, step-by-step plan to make sure the whole journey, for both the passenger and the vessel, is safe from takeoff all the way to landing? Well, that's pretty much exactly what antenatal care is. Okay, so here's our itinerary for this explainer. First, we'll get the mission brief. Then we'll look at the modern schedule, cover the pre-flight checks, see how the journey's monitored, check out some in-flight upgrades, and finally, prep for a safe landing. Let's get into it. All right, Section 1, a flight plan for pregnancy. Because before you take off, you gotta know the mission, right? So here's the official breakdown. Antenatal care, or ANC. It's way more than just a bunch of doctor's appointments. Think of it as this comprehensive program run by skilled pros with one single focus, getting the best possible health for both mom and baby. It's the master flight plan, the whole shebang. And this whole mission, it really boils down to 4 key goals. First up, you've got health promotion. Making sure everything is set up perfectly for growth. Then it's all about preventing complications, kind of like trying to spot turbulence on the radar before you fly into it. Third is early detection and management. So if a warning light flashes, you deal with it, fast. And finally, you've got your birth and emergency planning, because a good pilot is always ready for any kind of landing. Okay, on to Section 2, the modern contact schedule. This is your itinerary. Every good flight plan needs scheduled check-ins, and this journey is no exception. Now, this is where things get really interesting, because the thinking here has totally evolved. The old way was this focused model with just 4 visits. But the new model from the World Health Organization back in 2016 calls for at least 8 contacts. And that word change from visit to contact is huge. It's not just semantics. A visit feels passive, right? But a contact implies an active, two-way conversation. It's a game changer. And here's what that schedule looks like. You've got 1 contact in the first trimester, a couple in the second, and then look at that. They really ramp up in the 3rd trimester. It makes total sense, right? As you get closer to your destination, you need more frequent check-ins to make sure everything's on track. All right, Section 3, critical pre-flight checks. You would never get on a plane without a full inspection, and it's the same idea here. This all happens at that first big appointment, the booking visit. And the timing on this is absolutely crucial. This first, super important visit needs to happen before 12 weeks. Why so early? Well, because this is where you establish the baseline for the entire journey. Everything that comes after, every measurement, every decision, it's all going to be compared back to the data you get right here at the start. So this booking visit, it's basically broken down into 3 main steps. First, they do a comprehensive history. Think of it like checking the aircraft's entire maintenance log. Then you have the physical exam, a head-to-toe check to get all those baseline numbers. And finally, you have the lab work, which is where we really get to look under the hood. And these lab tests are like running a full diagnostic on the plane's systems. You're checking hemoglobin for anemia, screening for infections, and figuring out the blood group and rhesus type, which is super important for making sure mom and baby are compatible. HIV testing is also a standard part of this, usually on what's called an opt-out basis, which just means it's done routinely unless you say no. Okay, so pre-flight checks are done, the plane is in the air. Now the focus shifts to monitoring the journey. This is Section 4, your regular in-flight diagnostics. So at every single one of those follow-up contacts, the provider is basically checking the flight's dashboard. They're keeping an eye on the baby's growth by measuring what's called the fundal height. They're watching the mom's blood pressure, listening to the baby's heart. All of this is to catch any potential issues that might pop up later in the flight, like anemia or preeclampsia. And then, later on in the 3rd trimester, providers do this really cool check called the Leopold maneuvers. You can think of it as the flight crew physically checking on the passenger to see how they're sitting. It's a series of 4 checks on the abdomen to figure out the baby's exact position, making sure they're getting into that ideal head-down position for landing and not, say, a more complicated breech position. The best flight plans are proactive, not just reactive. So this brings us to Section 5, essential in-flight upgrades. These are all about boosting safety along the way. Okay, check out this number, 400 micrograms. Just burn that into your brain for a sec. So what is that? That is the daily recommended dose of folic acid. It's a tiny amount of a supercritical nutrient, but taking it along with iron supplements is one of the most important safety upgrades you can make. It helps prevent serious problems like maternal anemia and can even lower the risk of a preterm birth.
And it doesn't stop there. The full protocol also includes things like tetanus shots, really important counseling on nutrition, and depending on where you are in the world, things like malaria prevention or deworming. It really shows how the flight plan gets customized depending on the route you're flying.
Which brings us to the final and, you could say, most critical part of the journey. We're on final approach. It's time for Section 6, preparing for a safe landing with your birth plan. This is basically your final pre-landing checklist. You need to know who your pilot for the landing is, your skilled birth attendant. You need a solid plan for transportation. You should have some emergency funds ready to go. You should even identify people who could be potential blood donors. And maybe most importantly, you need to know what the danger signs are, what those flashing red lights on the dashboard really mean.
And these are some of the big ones. Things like vaginal bleeding, any convulsions, or even blurred vision, these are absolute red alerts. They're not wait-and-see situations. They mean you need to get to the hospital immediately. No delays.
And this really brings it all home. Think of the ANC protocol as a scheduled maintenance plan for a long-distance flight. It nails it, doesn't it? This isn't about crossing your fingers and hoping for the best. It's a systematic plan designed to catch small problems before they turn into huge emergencies mid-flight. It's what gets everyone to the destination safely.
So that leaves us with one last big question. We know this protocol works. We know it saves lives. So the real question is, how do we make sure that every single pregnancy journey, no matter where it happens, gets a first-class flight plan? Something to think about. Thanks for joining me.